Welcome to KMET 1490 AM ABC News Radio and the Southern California Business Report with Yvette Walker, a show dedicated to highlighting successful Southern California businesses and the people behind them.
Welcome and thank you for joining the Southern California Business Report on ABC News and Talks, KMET 1490 AM, 98.1 FM, and KMET TV. I'm Yvette Walker, live blasting our signal from the center of Southern California, serving a population of over 25 million. Get us crystal clear and on demand by downloading the free KMET live streaming app on Google Play or the Apple App Store. A huge shout out to the team as always. Mitch, Bill, and Sean, you make the magic happen. Thank you. And to our special advisory committee, Bill Morris of UCI School of Business, Joseph and Camila Rubio, thank you. And don't forget to check out the Jay Kaplan Show, also on KMET on Fridays at 3, as well as the morning show with Aaron Michael Sanchez every morning at 8. Today, everybody, I have the distinct pleasure to introduce Dr. Aileen Dinkjian. She serves as the Executive Director of Population Health at San Antonio Regional Hospital, Randall Lewis Healthy Communities Institute. Aileen leads the development of population health management initiatives and provides leadership and oversight for the HCI and community outreach programs. Aileen serves to address the healthcare worker shortage and elements of the educational achievement gaps through HCI programming by creating workforce pipelines with students as early as middle and high school students. Aileen has championed the translational science and public health workspaces and has a deep-rooted passion for disease prevention and community health. Aileen chairs the Health Equity, Diversity, and Inclusion Council and leads the Community Health Needs Assessment for San Antonio Regional Hospital. Aileen received her bachelor's in political science at Cal Poly Pomona, a master's in public health at George Washington University, and a doctorate in education at USC. Thank you so much for being with us, Dr. Aileen Dinkjian.
Thank you for having me. It's an honor to be here to speak with you today.
Wonderful. So, as you know, and I know one of the first questions that we need to talk about is to just please, walk us through your journey of how it is and what inspired you to now be the executive director of the population health at the San Antonio Regional Hospital, Randall Lewis Healthy Communities Institute.
A mouthful, right?
Yes, it is. It's a very, very big title, very big job.
Yeah.
Yes.
So I'm from the city of Chino. I grew up there, and I've been a local person for pretty much all of my life. And I first started, becoming interested in civic engagement and community health in general when I was a very young age. And my first job was working for the city. And eventually I ended up going to college locally at Cal Poly Pomona with a degree in political science. And after I graduated, I became a healthy communities coordinator. This was back in 2006 when healthy communities were kind of just popping up in different places in California. And I was just running programs across the city and partnered with the county and local organizations and loved it. I fell in love with public health. And so from then on, I decided that, I need a formal education in this because my background's all in politics. And it's different from what I've learned when I went and got my master's in public health in Washington, D.C. So I've learned a lot. I've learned to expand my horizons a little bit and ventured out of Chino. And when I came back, I actually spent some time at USC for the last 10 years working there as an administrator for a clinical and translational science institute. And so part of my journey has been writing grants or supporting grant efforts and in academia, in the private sector. So I've pretty much touched on all aspects of the community and fell in love with helping and support and address some of the diseases that I personally encountered within my own families and what I've learned in our communities with childhood obesity. And so what drew me back in the region is that it's because it's from where I'm from. And so when the opportunity came to lead an organization that titles Healthy Communities, I said, wow, this really speaks to who I am, everything that I've embodied, what I want to support as part of my life. Because one thing I always say to myself when it doesn't feel like work, it's really just what you love to do. And I love this area and love this field of being able to give back to the community that raised me.
Absolutely. That sounds like just the perfect match. And you have such a deep, background and very versatile background, right? So you can view these challenges from multiple angles. So with that said, can you just give us a general overview of what exactly the Healthy Communities Institute is at San Antonio Regional Hospital, when it was established, and maybe talk about some of the top goals that have been identified during the inception of the program?
Right. So the Healthy Communities Institute is a partnership with with Randall Lewis, who is a prominent investor and developer in our region, who has a very, very deep passion for public health. And so our service area covers about 900,000 people in San Bernardino and some parts of Riverside County. So our goal really is to help people stay out of the hospital and help them improve their own health within themselves. So the Healthy Communities Institute was established in April of 2016. And the goal is really to work towards eliminating healthcare worker shortage, improving the educational attainment gaps, and creating those pipelines with students across our region. And our mission is really to help support and understand our underrepresented populations and engage them with us. And so part of that is not just having them come to our institute, but to also go out into the community and give presentations and workshops and being present. And some of the 3 areas that we focus on, again, is healthcare workforce, the non-clinical healthcare internships that we offer, and community health initiatives and programming.
And so, during your time as you're addressing some of these main challenges, what have you identified as, the top 3, right? You say the pipeline to healthcare providers, education for non-clinical positions at the hospital, and of course, like you said, programming that educates the community on how to maintain a healthy lifestyle, and like you said, keep them out of the hospital. Please talk about how you have been able to develop and are activating programs or efforts that are aimed to these main categories.
Yeah, so I don't do it alone. I definitely have a team, which is
Right.
phenomenal. My team has been out in the community, and one of the driving guiding documents and guiding forces is the community. So we listen. So we've held a community listening session and also conducted several interviews to understand what are those priorities that we need to address. And this is called a community health needs assessment. And we did this in partnership with one of the leading healthcare consultants in our region. And this really helped us think about what is it that we need to invest in our community and in the well-being, and is it equitable, attainable, and to understand some of those clinical and community challenges and prioritize, right? So what do we know? So some of those examples of what we've learned is to focus on issues of cardiovascular diseases in our community. Diabetes, mental health is very prominent, and behavioral health. Even maternal and infant health as well is one of the major areas that we've learned from our community. And so we've used some approaches and try to understand some of the vital conditions, what we call vital conditions to well-being of people and places that are social and environmental drivers to our health, right? So that would include like our basic needs for health and safety, our living conditions, and where we work. And some of this also comes along with some of the health disparities, right, in serving our communities of color, individuals who are living in poverty or are with low income, seniors, and people that are in remote areas. So how do we reach out? How do we address some of those health issues, right, in those communities, and be able to be present again to address some of the issues and keep them healthy, like we said.
Right. So are there certain benchmarks or indicators that you're looking for to say, yes, these programs are working, we're making an impact, and this is why, the mission is, successful as you move forward, given the fact that it is a newer program at the hospital?
Yes. So, the positive impact that we're making is definitely collecting the data. The data points to how many people will actually show up in some of these events that we host, right? And if they don't show up, why aren't they showing up? Is it because they don't have access to the technology, or do they don't have access to transportation? So we always consider these issues as part of how we deliver some of our messaging, some of our information, and being cognizant and sensitive to our culture, the culture that exists in our community. So again, some of those benchmarks are obtained when we go into the high schools or health fairs and conducting workshops and getting the numbers again of how many are attending these events. And so to be able to make a positive impact, we try to understand, okay, if they're not showing up, how do we get them to respond to us, right? Again, we want to engage them. Is engagement an issue? So what are the barriers to be able to communicate with them, right? And understand, is it something that we need to provide additional resources for? And do we have that capacity? So these are all questions that, as an institute, I like to question and ask ourselves and look within. Do we have the means to be able to provide and support our community? And not just, I don't speak it broadly, but we have to be really targeted and specific of the different ethnic groups that exist, gender, social, economic statuses, so that way we are delivering the services that we intend to deliver.
Right. And when you talk about disparities, as you know, just our region in general, naturally, without, looking at communities or even different cultures, has a major disparity when, measured against surrounding areas, right? So please talk a little bit about the disparity of healthcare providers per, population, and the work that you're doing to, get ahead of that, because it is really, especially in our region, an uphill battle. Please talk to us about that.
Yeah, so when we think about healthcare providers, we're not just talking about the physician and nurses and even allied healthcare professionals, which are administrators and non-clinical support, but also we have to think about community health workers that are extensions to the community, and we want to consider them as part of our healthcare team. And so, for example, our region is predominantly Hispanic and Latino, and although we do serve all ethnic groups, and that's an area that we want to pay attention to because it is different from other providers. So, for example, in LA County, right, we are healthcare providers from South Central LA have a different population that they address and attend to in terms of how community health workers are supporting them. So, what we call here, for example, community health workers, there are also promotoras who are out there. It doesn't matter what their educational level is, but if they're able to explain a health issue with someone that can identify with them and relate to them, they are more likely to, for example, lower their A1C level, as opposed to someone who's telling them what it is and providing information how they can support their health and well-being if they can't relate to them. So when I think about the relevancy of our region and the people that we serve, if we look at it, again, in LA, in South Central LA, the population could be predominantly African American or Black, and they would be considered cultural brokers as opposed to what we term as promotoras, and very different how they're served, because we're talking about social and safety issues that they are concerned with that is different from the issues that some of our population that we serve in our region are concerned with. So, but again, there are definitely common grounds that are some areas that we need to consider and how we can partner best to address those resources that we need to centralize and capitalize on.
Right, which is why it's so important that the workforce development pipeline is something that you look at, right? Because in addition to those disparities is just the actual physical limitations, right? Because when you look at San Bernardino County, you're looking at one healthcare provider, one physician that is supposed to serve over 300 people, a population of over 300. But when you look at surrounding communities, that ratio drops substantially to almost a third of what we're looking at San Bernardino, right? So LA County, it's what, like 1 to 75, Orange County, you know the numbers, but that is why even more the workforce pipeline is so critical. Please talk a little bit about that, what you're doing, and what you hope to achieve through that effort.
Yeah, so we have a program called the Young Healthcare Professional Program, and it's really focused on the allied healthcare careers. And again, those are, for example, health administration, technical support, diagnostics, and the goal is really to promote skills, life skills to high school students who would then be trained and provide and would be certified to train middle school students to understand and gain some of the real world experiences in healthcare. So we do provide exposure, and we have internship opportunities that allow students to come in and actually see what it looks like to, what these fields may look like. So one example is that someone might be interested in becoming a doctor, but realize they may not like biology, for example, right? Or some of the components of medicine. But there are what we call an off-ramp where they can take a different route. And so we provide these career development opportunities for students to understand and increase their awareness of what other opportunities exist, as opposed to just this traditional standard career in medicine, which is becoming a doctor. But we also support career readiness. So people may not be ready to start and launch into a career because they're still figuring it out at a very young age. But we do help support resume building and developing skills in interviews, and also just basic life skills. We offer opportunities for them to learn how to cook. What is food safety, right? Managing your money is a big one, and those things are not always taught in schools. And so we come in and we try to help create this mental resiliency in our community and maintaining overall wellness. And that's all encompassing. And a lot of it is really just providing those tools in your belt that you can just pick and choose. Okay, I'm ready to use this, or help build those strategies that as they move forward in their careers. So, and these are evidence-based techniques that we provide. We are very supportive of in our community.
And what do these programs look like? Are you partnered with local schools? Is it a complete curriculum? Is it like a weekend thing? What does this look like for students that are interested in, a healthcare career pathway?
Yeah, so we do partner with our local districts. One of them is Chapey Joint High School District, and our goal with that is to help them, again, guide them and provide opportunities. Another program we have is just called Wealth, which is Wellness and Healthcare, and it also provides wellness education, healthcare workforce, professional development training to the next generation of healthcare professionals. So our goal with the high school students, they're trained, right? For example, in peer health mentoring and delivering health education to the middle school. So our partnership with them is ongoing and has been very strong. And now we're actually getting other high schools coming to us and asking, how can we get you involved? And again, it's reaching our goal of engagement. And so that's what we wanted to see as part of our institute, is that level of engagement in our community. And part of it is that not a lot of people would hear about us and know about what we're doing, but we're doing our best to kind of consciously raise awareness of opportunities that exist within the hospital.
Right. So what can school administrators or parents that are interested in the programming that you're spearheading, do to engage, if they have children or students that they feel are, leaning towards that field, or see an opportunity to be a part of that pipeline, how can they connect with you, or what are the opportunities that exist on that front?
Yeah, they could just reach out to us and let us know that they have an interest. And part of it is that we're always out there. We're always out in the community. And sometimes our team is approached and asked questions about, how can I get certified to learn about medical Spanish? And this is something that we are starting to do in the high school level by providing certification opportunities. So that way, when they are considering different career paths, is healthcare one of them? How do they know, right? And so we're happy to provide guidance, and our internship opportunity is one of those that we again provide, which is students who are looking to maybe complete a practicum at a college level and have some kind of field experience. We offer that, or they can volunteer with us as well if they want to be a part of all phases of our program, which is like planning, the implementation and evaluation part. They'll get exposure to that. So again, it's all encompassing, and these opportunities are very open to to the community for them to come to us. And I know high schools also have hours that they need to complete as well. So these are things that we would be open and happy to plan alongside with administrators in the high schools, in the middle school, and figure out what is it that we can address and talk about that is relevant to their specific teachings in these schools. So, for example, there's one high school that has an existing program, a STEM program that leads into these healthcare careers, and so we do work with them and provide them that opportunity. But there may be students in other high schools that don't have that type of organization, and they can reach out to us individually as well. So we're open to all of that.
And so for anybody that's listening and you may have piqued their interest, like I said, administrators or parents, is there a specific website? Is there a specific contact that they can reach out to where they know, I know I'm going to be connected to the Healthy Communities Institute and I'm going to speak to somebody or have my message, heard?
Yeah, you can have them all contact my CEO, John Chapman. I'm just kidding.
Oh, there you go. Let's give out his email address and his cell number, right?
Post it all on the public. I'm just joking. No, they feel free to, contact me directly. I'm happy to share my information. And we do have a website that we are planning to update more recently. So that way they can visit our website at sarh.org and look up Healthy Communities Institute and see what type of opportunities we do offer currently. And some of them are non-clinical internships. And again, we will be providing more details of what folks can do, and they can sign up and subscribe as well, which is one of the areas that I plan to implement in the coming weeks.
So for the time being, what is the feedback that you've received from that part of the Healthy Communities Institute mission, the educational part of developing and, growing that pipeline of healthcare providers for not only for San Antonio Regional Hospital, but of course for the healthcare system as a whole?
Right. So the workforce, we've learned a lot, right, from COVID-19. A lot of things emerged in terms of what people were feeling at that time. And so we are always trying to do our best to address the immediate needs, especially the shortage of healthcare workers that we're seeing today. And so I think not even just healthcare, I think in all areas, in all disciplines, in all kinds of workplaces, there's an experience of shortage. And so one thing that I've learned is that when we hire, we look for folks, it's not always just about the education or the experiences that they have obtained, but what kind of skills do they have? Is it transferable skills that can be taught and learned into, within our institution? And those are valuable because sometimes, there are opportunities that exist and it could be missed for some. And we want to make sure that we don't miss those opportunities or we don't overlook those opportunities to give for those that have the right skills for some of our technical, diagnostic, and rehabilitation areas that would be vital to our mission. So we're always looking for, who is it that's out there that is interested, just genuinely interested in providing patient care, cares about the community well-being. And I think the heart is where it speaks to, where we need more of that at the bedside. And so that's really critical in some of the work that we do, which is seeing that compassion. And I think people could relate to their own experiences of, so at some point in our lives, we become caretakers, whether you have children or you have elderly that you take care of, right? You want to be able to see that. And if they have that type of ability to be a part of a hospital setting or a healthcare setting, I invite them to apply and join us in our team.
So just briefly talk about a few of those transferable skills that people may not automatically assume are things that would be valued by a hospital system, but, they've probably thought about changing careers and, viewing this as a prospect. So just talk really briefly about some of those skills that you feel are most transferable and welcome at the hospital.
Yeah, one of the major ones is customer service. If you have great customer service skills and you know how to communicate well, or those, we always learn to improve our communication skills, right? If you have great customer service skills, that can go anywhere from, speaking to a patient to speaking internally with your partners and organizations, with your colleagues. That's important. That's a skill. Interpersonal skills are so key to making sure that we're efficient, that we're effective in what we deliver as part of our care. And that's something that I think most of us, have. If you work at a maybe at a restaurant or at a fast food place, you've dealt with difficult people, difficult situations. You're going to deal with difficult patients or difficult people. So that for me is number one. Is having great customer service. So you just have to kind of be patient and learn to be patient with how you deliver your messages to individuals. So
right.
Mhm.
So we have to be patient with the patients, customer
Yes.
service.
Yes.
All right, so we're heading up to a break. So for those listening, I'm Yvette Walker on Southern California Business Report on ABC News and Talks, KMET 1490 AM, 98.1 FM, and KMET TV, talking to Dr. Aileen Dinkjian as we discuss her work in population health at San Antonio Regional Hospital with programs aimed at closing the gap to healthcare access, communication, programs, and workforce development to enhance, streamline, and anticipate the needs and healthcare delivery to our region when we return.
Every 2 seconds, someone needs a blood transfusion. Be on the giving side. Livestream Blood Bank supports patients in 80 Southern California hospitals. Call 1-800-TRY-GIVING for more information and to set an appointment.
City of Hope is driven to making a difference in the lives of people with cancer and diabetes. We accomplish this by conducting innovative research and providing outstanding care. If you or a loved one has received a cancer diagnosis, go to cityofhope.org to learn more about how our innovative approach could change your outcome.
Cal State San Bernardino is home to the only school of entrepreneurship in California. With globally ranked degree programs, you can start your journey today to become a successful entrepreneur. Learn more and connect at entre.csusb.edu.
Ontario International Airport is onto a better way to fly with over 65 daily nonstop flights to more than 20 major destinations and the easiest airport experience in Southern California. Visit flyonto.com/Ontario to learn more about Ontario International Airport today.
Hi, I'm San Bernardino County Sheriff Shannon Dykes. If you're looking to start an exciting career in law enforcement and make a difference in your community, we are hiring dispatchers, nurses, deputies, laterals, and many more. For a complete list of our jobs and more information, visit sheriffsjobs.com.
The University of La Verne is rated first in California for alumni satisfaction. Learn more about accelerated programs offered online and on campus in La Verne, Irvine, Ontario, Burbank, or College of the Canyons. Visit go.laverne.edu. The University of La Verne. go.laverne.edu.
It's summer, the sun is shining, and now's the time to make the most of your solar panels. Don't lose up to 50% of your solar panels' efficiency just because they're dirty. Get the most out of your solar panels and call my friends at Solar Panel Cleaning Specialists at 951-663-7502. That's 951-663-7502. Mention this ad and receive your discount. Offer expires December 31st. Welcome back. Welcome back. For those listening, I'm Yvette Walker on Southern California Business Report on ABC News and Talks, KMET 1490 AM, 98.1 FM, and KMET TV, talking to Dr. Aileen Dinkjian as we discuss her work in population health at San Antonio Regional Hospital with programs aimed at closing the gap to healthcare access, communication, programs, and workforce development to enhance, streamline, and anticipate needs and healthcare delivery to our region. Thank you again for being with us, Dr. Aileen.
Pleasure to be here. Thank you.
Beautiful. So before the break, we were talking about, general terms. What is the Healthcare Institute at San Antonio Regional Hospital? What is it that you do? What is your mission? And specifically, we were targeting on the educational element and the pipeline that you are working hard to establish to encourage, our next generation to enter the healthcare workforce.
Right. Yeah. And so I wanted to also emphasize that, being a leader in this area to create this workforce pipeline. It's all about equity and also delivering high quality care for our patients. And so some of that, information that some of the information I wanted to share is that we want to deliver high quality, culturally sensitive care to our diverse patients, and we're not monolithic. So everyone speaks a different language. There's different folks that may have different perspectives and beliefs, and so we want to be very understanding of those care. And some of the folks that we want to hire are those that we want to, or we want people to have a good general understanding of how to be culturally sensitive, and we do provide trainings for that. So again, we were talking a little bit about what is it, how can students participate or be a part of the learning process in healthcare. And again, if they don't get into med school and feel rejected and discouraged, there's always other avenues in healthcare that many of them could partake in. And so it could be in the provider space, or it could also be in the clinical setting, or even in research. And that's a background that I was in for about 10 years. I was a research administrator. Didn't think I would end up in there, but I did. And I was there and I fell in love with it. So again, there's so many different avenues that many folks could consider. It doesn't even have to be those that are right off of high school, but it could be any age. It could be anyone that's interested in health in general.
Right. So I know one of the main areas that you focus on as well and deliver programming for internally is communication, right? Communication between the healthcare provider and the patient. Please talk a little bit about that and what your goals are when you deploy that program, and what you're hoping to see from it.
Well, again, it's really important that we understand what is the patient's primary language, right? And so we take this information upon them registering with our hospital. And so we take this and utilize this information as we develop or we speak, we deliver or we have conversations with the patients and provide them with discharge instructions, so that way they continue with their care after they have a visit with us. And so what's important is that what's nice about what we currently do is that we have an opportunity to work with an existing robust data system as well. And again, I want to talk about communication, and this is part of the implementation of what we are utilizing to understand some of the equity issues that exist between different patient populations. And so by identifying some of these service areas and the inequities among different racial and ethnic, gender, socioeconomic groups, we can analyze immediately what kind of intervention we need to provide. And so we can't just go with what we currently have. We always try to improve the type of programming we deliver for our patients. So when I speak about cultural sensitivity, I'm talking about how we communicate health treatments and conveying information to folks that are, again, of different backgrounds and of different abilities, different gender, and again, we are all made up of multiple identities. And I'm really proud of the organization that I'm in, because we don't perpetuate on like the stereotypes of what we know about different communities. And so I think having that general understanding and being able to implement as we go and improve our process, that's vital to how we deliver our care in our hospital setting.
Right. And that to me resonated very much because, I'm Latina. I grew up in a very Hispanic household, in a Hispanic community, and I witnessed and lived, the cultural divergence of what healthcare is and how, we view ourselves and how important our healthcare is, right? And a lot of times it's just those cultural and psychological barriers that, unfortunately, like as a working mom, let's say, we will put ourselves last until we absolutely can no longer move. And then it's a health problem that should have been addressed, over 20 years of missed physicals, mammograms, labs, and everything else, which, I love that you're focusing on, because you're able to deliver that message in a voice that resonates with the different communities, that kind of speaks to them from their view, and saying, we understand you're busy. We understand, you love and you serve your family and, do everything for everybody else, but on the same token, it's also important that you keep up with your own healthcare so that you're able to be healthy, so that you can continue to thrive and love and serve and be there for the people you love most, right?
Absolutely. And so one thing that I really love as, the characteristic of San Antonio Hospital is that people have a sense of belonging. And I think that's what I was most impressed with, when I first came to the hospital, is that people have been there who have worked there for, 50 years and have not left. Or, if they have left, they come back and the
Right.
grass is not greener on the other side. And patients that have been there have delivered multiple babies throughout the hospital. And that sense of belonging really is the community that we want to have. Is they're part of the community, we're part of their lives, and it's ongoing care. And the way that, our institute is also supporting, encouraging this type of engagement is key to making sure that they're always constantly receiving information from us, that we're communicating opportunities to involve them, or for them to even share information whenever it's comfortable, or us providing them, other treatment care opportunities or treatments that they may not have considered. Those are important to making sure that they have all the relevant information, all encompassing partners that we work with that could help support their daily well-being.
So when you examine that data and you're looking at creating that communication pipeline, let's talk about the definition of what success looks like to you and to the Healthcare Institute.
Yeah, so that's a good question. So, again, we recognize there's a critical shortage of our frontline healthcare workers, and this is complex. There's community level inequities that exist in our health and well-being infrastructure. So, and I want to just really emphasize this, because we're looking at a community with food insecurities, and these are data that comes in, and we learned this from, families, like you said, people working 9 to 5, they put themselves last. But then, although they're trying to put food on the table, they may not be able to cover their rent or their electricity bills. And so, and there's also that aspect of people have lost their job during the pandemic. And so, again, how do we make sure that there's access that's being provided in these specific, with these specific families? And we want to cultivate that relationship with our patients, or even those that are not patients of the hospital, but people in the community. Cultivating a relationship by providing, nutrition, education, which is something that has been ongoing with what we provide as part of the Institute. Again, it's not complicated on our end in terms of what we want to deliver, but it's really, very basic needs that we want to just share, that, remind people that there are, someone with a cancer, and we partner with American Cancer Society, who's provided us with a recipe book that's good for cancer patients. And, when I first saw this, I was like, I've never seen, a recipe book that's specifically targeted for people who have had cancer. And so, and I've had family who have had cancer, have died of cancer. And so this was really meaningful to me. And so whatever is meaningful for, the communities that we serve, we want to be able to provide that information as relevant as it is to them, and making sure that they come to us as often as they need to.
Right. And I just have to say, that's one of the things that I just absolutely love about San Antonio Regional Hospital. Forget about the fact that I've treated with them for over 20 years, myself and all 3 of my children, because, raising children, they provide a lot of excitement throughout their growing stages, right? So we've had plenty of visits to the hospital, and something that has always stood out to me is, as you mentioned, that family environment, that desire to really serve the patients with warmth and like a family environment, and that you have and found, somebody to help and support this program through Randall Lewis and the Healthcare Institute at San Antonio Regional Hospital to further engage and to be a greater proponent of healthcare delivery and communication for a better quality of life all around. So taking that extra step, putting out that hand, and inviting the community to engage and to realize a better quality of life is just something that it just enhances and increases my respect and love for the hospital as it stands.
Yeah, it's definitely it's been around for so long. And so, and I think that's what's driven the community with the hospital itself, and how it's embedded and how it even came about in where we serve. And Randall is from Upland as well. And so I think having that connection, and that's what I love about our region. People are very supportive. We all know each other. And I think we always try to support each other as much as we can in many different levels of our work, whether it's at the market or at the hospital. So again, what we want to do is really overall is reduce any readmission rates, that could have been handled through a primary care, but do they have primary care? So we also want to supplement or complement the care with possible insurance providers that could help them move through the process. And again, anything that could be avoidable through the emergency room is what we also look forward to, making sure that they are receiving the care and the aftercare in the proper setting. So again, and this all goes back into the workforce pipeline and developing people to understand that there's opportunities for them to learn from this process, whether they are a doctor or a nurse or allied healthcare professional. There's a lot that could be learned from that and bring it back home to their own families.
So with that said, let's go back to the clinical and non-clinical opportunities that you present to, those that are interested in pursuing, that career pathway. What does that look like? Is it on campus, at the hospital? Do you do tours? How does that look? What is it that you do to encourage that or demonstrate that?
Yeah, so we're looking at different models, a model that would really support the success of having someone come and be exposed to work opportunities at our hospital. And so one of the things that we are developing and planning right now is how can we create this internship opportunity for those that are interested in the clinical setting, and maybe they want to be a surgeon, but what kind of surgeon? We don't know. Maybe there's a way we can rotate folks in different areas. And part of the care setting is also pharmaceutical, right? So perhaps they may not like biochemistry, so maybe there's an opportunity for them to become a farm tech. I don't know. Those are things that I think is an opportunity for those that are interested in the clinical, non-clinical setting. Because again, when we talk about non-clinical, we can talk about those that are at the front desk, or they could be a part of the billing process. They could also be part of a research, be part of the IT.
Right.
Those are all critical areas. And right now there's this whole notion of, how do we utilize some of our electronic health records to be able to conduct research that would be relevant to the community that we serve. So, that's a whole different nature of the beast,
Right.
of what we could accomplish. And I think it's definitely doable when we talk about population health. We want to make sure we are moving people along the process, and when they're out of the hospital and into the community, they maintain their treatment, they maintain their health.
Right. And so when you talk about community health and your mission to deliver that, let's talk about what the community can expect to see from San Antonio Regional Hospital on the ground as you're communicating with the region.
Yeah, they can see us out there. We're doing colorectal screenings. We are helping folks understand their A1C level, whether they're prone to becoming pre-diabetic or diabetic. We are out there constantly providing mental health first aid training, which is helping folks understand, how do we culturally be sensitive in speaking to others about care, or how to avoid. Again, one of the areas is depression in our region. So again, we're constantly out there even within our own hospital. We're training our colleagues how to be mindful. Mindfulness is a big one that I think is vital to our well-being. And so we're always going to be out there in different regions, whether it's in Upland or Rancho Cucamonga, and so these are areas that we are constantly serving. But we are really open to inviting others who are interested in what we do to invite us to their community, and we'll be on the ground. And you'll see me there, you'll see our team there, and I think it's important to be present. And we don't want to be just speaking about these data, but we want to put the data into action.
Right. So, please talk a little bit about those major stakeholders that support and assist your mission in healthcare initiatives through the hospital.
Yeah, absolutely. So, I mean, again, we talked about some of the high schools we work with, and that's the Chaffey Joint Unified School District, Upland Unified, Ontario Montclair, and we also work with American Cancer Society, and we also have City of Hope right next to us as well. So that's an important stakeholder. And part of our partnership is also working with local organizations, and some have reached out to us, and we've been working with them consistently. And one of them is it's called HC2 Strategies, which is who is the leader of helping us create or understand our community health needs assessment, and providing some of the tools that we could use to pull some regional and local data that we need to understand. Social Impact Artists is another one that we partner with, and they are phenomenal in helping us understand issues among immigrants, the youth, working class families. And so these key stakeholders have helped us move the needle forward and making sure that we're not leaving anybody out. And so I think it's important to make sure that we have, we're always open also to learn from those that are interested in our becoming a part of I want to say, like, not community, but our group.
Right, of your team, of your
Our
effort,
team.
of your mission, right? Because it's a big mission. So really, you're going to need a lot of support. And I think everybody that's listening, like you said, even if you're not in the healthcare field, or you're in clinic or non-clinic, just part of the community, just sharing this information, right, with a friend or somebody that is maybe looking for resources, that in itself is support. And we could be like little mini stakeholders, right?
Yeah, absolutely.
Contributing stakeholders.
Right. I mean, one of the biggest thing that we have is our Health Equity and Diversity and Inclusion Council, which is so important because it helps us stay in tune and also stay focused of our mission, which is to continue to provide the support and the health and well-being of our community. So I think having ongoing conversations and dialogue is key. And we, again, work with our local organizations and community organizations to ensure that we are doing what we need to focus on.
Right. So does the Healthy Communities Institute have staff to assist in the deployment of these efforts? Do you have volunteers? If so, are there opportunities to support the Institute through volunteerism as well?
Yes. And so we have a community health manager, a supervisor, and our specialist. And we also have interns that serve about like 135 to 400 hours with our organization. So, and again, this goes from like a planning, implementation, and evaluation process. But yes, volunteers are welcome. We require volunteers to commit about 100 hours to be completed over the course of a year. And again, we can't have high quality care if it's not equitable. So I think what's nice about some of the folks that are coming in, they have some understanding or no understanding, but they learn what that means. And it's been outlined, with the Institute of Medicine that, equity is really an important part of care or quality of care. And so a lot of things that our interns and volunteers will learn is, the work that we do is valuable and it's meaningful to our community.
Absolutely. So what advice do you have for those looking to start a career in healthcare? And please describe your perfect volunteer for the Healthcare Institute.
Wow. Okay. So
two-part question.
Yeah. For anyone interested in healthcare, again, reach within. Is this something that you want to do? And if it's an area that would be, very rewarding. And I think that's what I see being a part of an organization that does a lot of good work is it's rewarding to me to see that we're helping someone improve their lives, improve their health. And you are constantly providing opportunities for folks that are just thinking about, well, I don't know if I want to be in healthcare. Well, yeah, okay, well, consider it, think about it, come with with us. And an ideal volunteer would be just someone that just wants to see, just check it out. Let us know if it's something that that might pique their interest, because we don't know. Sometimes people don't have that exposure, and they may not have thought about healthcare because they were taught to go into a business or open up their own businesses, but they may not want to. The door is wide open to anyone that has any interest, whether they decide, okay, well, I want to go into art or theater, but I think I still want to be in healthcare. Okay, great. Come check it out. Come volunteer with us. There's plenty of work to do. And there might be that little seed that's planted that makes them want to think about a future in healthcare. And that's what I value. And I think seeing someone having that initial heart would be something that's ideal for us to have as part of our team.
Right. And you mentioned art and theater, things that people would not normally associate with healthcare. But I recently learned that there are therapies dedicated through art, through music, that help assist, people in the hospital. Can you talk a little bit, just briefly, about those career pathways that are a surprise, I think, to most people?
I can actually speak to that because I've done a lot of different reading of people's research around it. And so music is therapy. And even the lighting, learning about lighting in art, and it helps with vision or subtle mental health issues that could be addressed through that. And so I think being able to express yourself in theater, and having that way of how you can help patients express themselves when they can't speak about what their ailments are, what's concerning them. That's key. I think that's important, that there's other ways to express yourself, not just through words. It's that art. It's that way of, communicating again in a different language. And it's music. It could be music. It could be the way people move, or how it moves them. So there's a lot of research around that, which is so important in healthcare.
It is. And it's so exciting. And I'm sorry, but we're to the end of the program. We're going to have you on because your work is incredible. But thank you so much for being with us today, Dr. Aileen.
Thank you so much. I appreciate being here.
Beautiful. So for everybody listening, don't forget to look for us on Facebook, YouTube, LinkedIn, and Instagram. Check us out on scbrtalk.com. And don't forget to download the free live streaming app on Google Play or the Apple App Store. Don't miss my interview with Kurt Hagman, who was elected to serve San Bernardino County's 4th District in 2014 and named chairman of the Board of Supervisors in January of 2019 and 2021. The 4th District covers Chino Hills, Montclair, Ontario, and the southern portion of Upland. Hagman serves on multiple boards, committees, and commissions like the Ontario Airport Authority, Inland Empire Health Plan, and San Bernardino County Transportation Authorities. Next week, we will have Michael G. Rademaker. He is proud to base his businesses in the Inland Empire. Michael first entered the real estate market at 19 years old, fueled by an insatiable desire to learn and a commitment to provide a unique yet superior product for his clients. Michael is no stranger to the Inland Empire and now owns and operates one of the leading residential and commercial real estate sales, leasing, and management companies in Southern California. So we will see you next week, everybody. Do not miss it.